All right, guys, in our last video, we talked about how a lot of consolidation within the healthcare space is leading to rural hospitals closing. We have another very similar, very scary situation to talk about here in Oregon. We're going to dive right into it, but we're going to be talking about how, due to consolidation, primary care physicians have left a network and left a lot of different people stuck without a primary care physician. So let's dive into this. Optum, buyer of Eugene's Oregon Medical Group, tells patients to seek care elsewhere as physicians leave. Let's dive in. A major Lane County healthcare provider owned by the controversial Optum Inc. is informing an untold number of patients that it will no longer treat them. In letters, Oregon Medical Group is telling patients that their doctors have left the practice and it doesn't have enough other physicians to offer a replacement. So Optum bought out this place called Oregon Medical Group. A lot of the physicians of Oregon Medical Group left en masse, and Optum is saying, we don't have any replacements for you, so you have to look elsewhere. Tim Christie, a Eugene resident and patient at the medical group for more than 2 decades, got the news on March 4th. His primary care physician was leaving Oregon Medical Group. We are not able to transfer your care to another Oregon Medical Group provider at this time, the medical practice said. So this person, Tim Christie, didn't do anything wrong, and he's still dealing with the fallout of this consolidation between Optum and Oregon Medical Group. The gist of the message was, thanks for being a patient, but you're fired, Christie said. I was dumbfounded. Oregon Medical Group is jettisoning patients because doctors are leaving the operation, but how many have left and how many patients have been dismissed from the practice as a result is unclear. Neither Oregon Medical Group nor its parent company, Optum, would say. So this is still in the early stages of this. We know it's happened to a couple people. We don't quite know what the impact is yet, so we'll be monitoring this to see what happens, but the early returns are not looking good. People are already losing the ability to see the primary care doctor that they trust. As is the case across the healthcare industry, when a physician departs, we notify impacted patients and do our best to transfer their care to other providers, Optum said in a written statement. The health and well-being of our patients is our top priority, and we are working with patients to ensure they have access to high-quality care. It just seems to have not worked in this particular case due to a couple anecdotal case studies. According to the Lane County Medical Society, a professional organization for physicians working in the county, 32 doctors have left Oregon Medical Group in the past 2 years. With some Oregon Medical Group doctors treating as many as 2,800 patients, the departure of 32 could make for a large number of impacted patients. So this is crazy. I mean, we're talking 2,800 people per doctor times 32 doctors. We are getting into the tens of thousands of patients that could be affected. You obviously want to keep the same doctor as long as you can. They know your story, they know your needs. Switching between doctors can lead to issues and delays and having to go through the same stuff over and over again. While Optum is dropping patients in Lane County, it's adding them by the thousands across the state. Optum and its parent United Health Group have shown a seemingly insatiable appetite for buying up healthcare assets that has already reshaped the industry in Oregon and nationally. Even as the Oregon Medical Group struggled, Optum was working to close a deal to buy another major Oregon healthcare provider, the Corvallis Clinic. So this isn't new just to Optum. This is happening all across the country. We talked about Steward Health Group. We talked about a bunch of other ones, Adelaide, which is an ACO. We see this in North Carolina with Novant Health Center. These conglomerates are coming in and just buying up everything. So this isn't just in Oregon. This is happening all across the country. It just has different names because there are different companies doing this. The decline of the Oregon Medical Group under Optum is a cautionary tale, said Representative Ben Bauman, who introduced a bill in this year's short legislative session intended to slow what he called the corporatization of medicine. I'm glad someone's standing up against this. We have seen this all over the country. We have done articles about this. This is a scary practice, which, as you can see, is leading to people lose their primary care physician. We've seen it lead to closures of rural hospitals. There are a lot of negatives to this consolidation and corporatization of healthcare across states and across all over the country. As private equity investors and big corporations take over physician practices across our state, they often promise access to care, Bowman said. But what we're seeing unfolding in Eugene is just the opposite. Physicians are fleeing and patients are left without access to care. After hearing complaints from constituents, Representative Nancy Nathanson, Democrat Eugene, last week went to Optum for answers. Specifically, she wanted to know how many doctors had left and how many patients were being cut loose. I'm still waiting for those numbers, Nathanson said. The bottom line is that when our local medicinal community is expressing alarm and the number of patients without doctors now could be in the thousands, we have a growing crisis in access to basic health care. She hit it on the head. Again, this is happening everywhere, guys. This is something that we really need to look into, not only in the state level. I applaud these local Oregon representatives for trying to stand up and making sure this isn't as big of an issue as it is. This needs to happen on state levels, and it also has to happen on a federal level to stop this consolidation. Oregon Medical Group has operated in Lane County for more than 36 years. It was physician-owned and grew to become the second largest medical practice in the area. Then came 2020 and the pandemic, which was brutal for healthcare practitioners on several levels. Not only were they facing tremendous personal risk, but their non-COVID business plummeted as patients avoided medical offices. Many doctors, nurses, and other practitioners quit or retired early. Clinics and practices saw their profits wane, and some looked for exit strategies. In the case of Oregon Medical Group, the strategy was its acquisition by Optum. The two companies quietly closed the deal in late 2020. What a lot of people don't realize is many primary care doctors, your local mom and pop doctor, struggle a lot to stay open. Now, there's a lot of reasons for this, but a lot of times they are forced to join these conglomerates. And I've had a doctor tell me, off the record, I unfortunately can't say their name, but they said they can't negotiate with insurance companies as an independent doctor. Think about that for 1 second. They were forced to join a conglomerate just so they could actually get reimbursements from an insurance company. That is a scary thought to have. It stops independent doctors from staying independent. I've actually talked to a local pharmacist near us. It's actually the third episode of our podcast, Talking Retirement, but he talked about how a bunch of independent pharmacists had gotten together and created an independent pharmacy block, and they were able to get some bargaining power by working together while maintaining their independence. Optum's unprecedented expansion campaign and voracious appetite for new acquisitions in just about every facet of healthcare has drawn harsh criticism from provider groups, labor, and academics. Dr. John Santa, very cool name, a retired physician and former member of the board that oversees the Oregon Health Authority, said a concern is when Optum or its parent company, United Health Group, buys up medical practices and clinics, they can choose which insurance plans to accept, potentially limiting access to the most vulnerable patients on public insurance. If you look at United Health's track record, there's communities all over the country that are furious at United, Santa said. Their goal is making money for their shareholders. So what's happening here, guys, is a term called vertical integration. If you're not familiar with business or economic terms, vertical integration is when one company buys up many different aspects of an industry top to bottom. So horizontal integration is you buy up all your competition. So that's an insurance company buying up other insurance companies. What vertical integration is when an insurance company buys up doctors' offices and hospitals and billing companies and, you know, all the other aspects of their industry that they might be a part of. Last year, a court ordered United Health Group's insurance arm to pay $91.2 million to settle claims it underpaid providers at a Nashville-based medical group for essential care. Also last year, a California-based nonprofit group of hospitals and physicians filed a lawsuit accusing Optum of anti-competitive practices, including a concerted effort to steer patients to Optum providers in a bid to monopolize healthcare in the region. Monopolies are bad in general. Monopolies in healthcare, very, very bad. Optum has quietly built a considerable presence in Oregon. The company controls several clinics, hundreds of doctors, hospices, home health agencies, ambulatory surgery centers, and mail-order pharmacies. In 2021, Optum purchased Greenfield Health, a Portland-based independent primary care group. Last year, the company acquired LHC Group, a home health and hospice care provider that operates 9 locations across Oregon. In any, free market society, we want lots of options. When someone starts buying them all up, that's when we're going to start having issues. So we're already starting to see the early returns on how this can be an issue when there's consolidation. We're going to keep tabs on this because I'm sure there will be many more articles talking about what is happening here in different parts of the country. Optum most recently cut a deal to buy the Corvallis Clinic, which operates 11 clinics that serve patients in the Corvallis area and parts of the Oregon coast. The proposed merger was approved on an emergency basis, sidestepping the state's regulatory review intended to prevent corporate buyouts of physician practices from harming local access to healthcare. How did they sidestep it? That's crazy. Lawyers for the Corvallis Clinic asked the Oregon Health Authority to immediately approve the acquisition, citing that the business was in dire financial straits and would have to stop seeing patients. The emergency approval came amid a recent cyber attack on another subsidiary of United Health Group, Change Healthcare, that cut off insurance payments to clinics across the country. Health clinics across Oregon burned through cash reserves as they were unable to get reimbursed for their services, but it's unclear whether the Corvallis Clinic was impacted by the cyber attack fallout. Much of its filing to state regulators was redacted. Dr. Nick Jones left Oregon Medical Group in October, roughly 24 months after its acquisition by Optum. Jones said life under Optum was a frustrating mix of bureaucratic paperwork and unrelenting pressure to produce. He had more than 2,800 patients. That's insane. Think about how many people you have to see per day. So I did the math. Assuming 5 days a week, that's about 11 patients a day. So it could be tough for people to get all the help they need. Obviously, some people are quick in and out, but you can tell that this guy is really feeling stressed and doesn't like it. On top of that, Optum began offloading billing and code entry work onto physicians after the buyout, Jones said, a practice he thought was a waste of our time. So it looks like they're trying to get rid of billing departments, which is crazy because I don't know why doctors would have to do their own coding. It would make sense for someone else to do that, but it seems like they're just trying to cut costs. We've seen locally, it's becoming harder to get through to actual doctors' offices because these conglomerates are outsourcing all of the billing and appointment work to one centralized hub that is often not even in America. So like there's times our clients are wondering if a specific doctor's office takes certain insurances or something like that, and they literally can't get through to the doctor's office because that number is no longer publicly available. They're always getting sent to a more centralized hub of receptionists that may or may not even be in the country. It was about money, Jones said. You had this absurd quota of patients. He has since opened his own practice. That's good. I'm glad that he is using this anger and opening an independent practice. Dr. Bruce Thompson, a retired physician based in Corvallis, said his son is a patient of Oregon Medical Group, and Thompson often accompanies him in appointments. He recalled an appointment in late February when a provider said they felt like a zombie. What these organizations create is an atmosphere that leads to moral injury for medical providers. It's different from being burned out, Thompson said, referring to the stress of being made to act in conflict with one's values. The moral injury, he said, is the result of when a medical professional is being told how to take care of patients by someone in the business office. This should never be the case, and unfortunately it's becoming more and more common. Business heads, private equity people are telling doctors how to do things in order to save money. At the end of the day, it becomes the doctors feel stressed out. They feel like they're not giving the care that these patients deserve. And in many cases, the patients aren't getting the care they deserve, which is leading to this cycle of worse and worse outcomes for everybody but shareholders. Carl Carmichael, really cool names here. Carl Carmichael, 84, had for years been a customer of Oregon Medical Group, but in 2023, his primary care doctor informed him he was leaving. Months later, his replacement physician also left the practice. That's when Carmichael, a former university professor, got the letter. Oregon Medical Group said it didn't have anyone left to serve as his primary care physician. The letter was signed not by an Oregon Medical Group executive, but by Imelda DeCones, market president of Optum Pacific Northwest. I apologize for the loss and hardship this may cause, the letter for DeCones said. I want you to know that we are committed to caring for our Eugene and Springfield communities in the long term. I'm hoping that the ship gets right, but we're already seeing issues here. I'm a broken record, but this is insane. Christy, the Eugene resident who learned this month he could no longer receive care from Oregon Medical Group, had been a patient there since he moved to the area in 2000, so over almost 25 years. He liked and respected his primary care physician, Dr. Carl Saxman, who had helped Christy manage a chronic health problem. But last fall, after a checkup appointment, Saxman told Christy that he was leaving. Saxman said another Oregon Medical Group doctor would take over for him. The letter from Oregon Medical Group said otherwise. So maybe Saxman even got told something different, but this is a huge deal, and we see this sometimes when there's gaps in people's insurances. If you have a chronic condition that's getting managed well, if you were suddenly not able to get it managed in the same capacity for maybe 2, 3, 4, 5, 6 months a year while you find a competent primary care doctor you can trust, there could be huge issues. The chronic condition could come back. This is not a good thing. We are working to build new services and rebuild our care teams to enhance our access and to better serve you and your community, it said. But that rebuild will come too late for Christy, who would have to find another doctor elsewhere. It's very disconcerting, he said. I just can't believe they put me in this position. What do I do now? This is very stressful, and my heart really goes out to all these people affected by it. Corporate consolidation of healthcare is not going well for anybody but the business people that make these deals, because they can corner the market and force people to deal with less than ideal conditions that take money off the top. So what do you think about this? I would love anybody from Oregon who's watching this. We're not licensed in Oregon, but if you have any comments, if you've looked into this story or you've personally dealt with this, we'd love to hear in the comments like what your experience was. Has a consolidation of a healthcare group happened near you? You know, we could talk about North Carolina, South Carolina, Georgia with these ACOs popping up. What are some instances where this has happened to you? Please let us know in the comments below. And if there are any other articles you'd like us to cover, we'd be happy to. As always, I'm your Medicare guy, Ken. This has been Medicare news, sometimes just general health insurance news. So be sure to like and subscribe. And if you have any other questions, be sure to reach out to us at NJ Life and Health at 848-226-6897 or visit our website at www.njlifeandhealth.com. Thank you and see you in the next video.